Good morning. So this is the second part of the lecture on congenital heart disease. This area we would like to discuss about the a congenital disease of the heart, in fact the aorta. So when the aorta is narrow, and this narrowing of the aorta is known as coarctation. Coarctation of the aorta, narrowing of the aorta. To understand this particular subject, we need to understand this picture of a patent ductus arteriosus. If you look at this diagram, you can see that from the right chamber of the heart, particularly the right ventricle, we can see that pulmonary trunk or artery is coming up, which is dividing and going to the right lung and the left lungs, and this green structure is a patent ductus arteriosus. In a baby who has a patent ductus arteriosus, these black lines showing the flow of the blood. So I said that mostly you can see the normal patent ductus arteriosus up to 7 days from the date of birth. So you can see the flow of the blood normally from the aorta to the pulmonary artery if the ductus arteriosus is patent. So now we are going to discuss this congenital disease of the aorta, which is known as coarctation. It is more common in male, and most of the time coarctation of the aorta associated with other abnormalities, that is PDA, VSD and ASD. Most common association is with the patent ductus arteriosus. Once again, you get a Turner syndrome, which is often associated with a patient with a coarctation of the aorta. So what is the karyotype of the Turner syndrome? You know, it is 45XO. So what is the definition of the disease? It is a obstruction due to the narrowing of the aorta. Now this location of the narrowing is the most important part of our study. This obstruction can occur before the ductus arteriosus, or it can be after the opening of the ductus arteriosus in the aorta, before or after. If it is before, we call it a preductal. If it is after, we call it a postductal. And the word ductal means ductus arteriosus. So the coarctation of the aorta can be classified into two basic types. One is preductal and postductal. Classically, a preductal type of coarctation of the aorta is the infantile type, which means it is present in the infant, whereas the postductal type of coarctation of the aorta is classically adult type. It means which is present in the adult. Now when I say adult, we try to consider someone over the age of 18 years. 18. So I want you to see the picture which is here to understand what is the understanding of a preductal or infantile type of coarctation of the aorta. This pink tube representing the aorta and that white tube represent a patent ductus arteriosus, which is classically patent in an infant. So technically, when you say infant, it is a small kid, say just a kid which is 3 weeks old, 21 days. So let us consider this small little kid has a coarctation of the aorta also has a patent ductus arteriosus. And here we see, look at the picture, the C for coarctation is the location of narrowing. If you look at the narrowing location, it is classically situated before the opening of the ductus arteriosus in the aorta. So we call it a preductal. So what can happen if there is a narrowing here? You can easily understand by this yellow arrow that most of the blood cannot go to the lower extremity because of the narrowing. So this blood which cannot go to the lower extremity will now be going to the vessels of the upper extremity, which means the vessels of the upper extremity once again are getting extra amount of blood, which will produce a hypertension in the upper extremity. So this is an important consideration that can occur in all cases of coarctation of the aorta, whether it is preductal or a postductal. So we get a hypertension of the upper extremity. Now let us look at this area. Since the blood is less postductal, so naturally the intraluminal aortic pressure is less here, and sometimes this pressure is less than the pressure we can get in the pulmonary artery. As a result of this thing, there would be shunting of the blood from the pulmonary artery to into the aorta. Now this blood in the pulmonary artery is a blood which is a bad blood, means this is a blood which is not oxygenated properly. So this blood is coming to the aorta, and finally this blood is reaching to the lower extremity organs. As a result of this thing, you can get a cyanosis in the lower extremity. So what is the conclusion? Conclusion number 1, that most patient with a preductal type of coarctation has a patent ductus arteriosus. This patient has a narrowing of the aorta before the opening of the ductus arteriosus in the aorta. As a result of this coarctation, most blood will be diverted back into the upper extremity. So we get a hypertension in the upper extremity. As a result of the patency of the ductus arteriosus, the blood from the pulmonary artery will be diverted back into the lower extremity. So as a result of that, you get a cyanosis of the lower extremity. You got it, right? So this is a infantile type of coarctation of the aorta. If you look at the adult type of coarctation of the aorta, which is often known as postductal, the most important thing to notice here, that ductus arteriosus is not patent here, which is obvious in an adult patient. So this ductus arteriosus is just a fibrotic cord-like tissue connecting the aorta and the pulmonary artery. Now what will happen in this scenario? If you look at this location of the coarctation or the narrowing, it is typically after the fibrotic ductus arteriosus, and that is why we call it a postductal. So naturally here, once again the same issue, the blood which is in the aortic arch, it cannot passes through this narrowing. Some of the blood will definitely go, but most of the volume of the blood will be diverted back to the upper extremity, and once again we get a hypertension occur in the upper extremity. So presence of hypertension in the upper extremity is a feature of both adult type and infantile type. Now what will happen to the lower extremity? In the lower extremity, since it is getting less blood, so the blood pressure will decrease in the lower extremity, and as well as you can see the decreased number of pulses. So it is very important to understand, in the upper extremity we get a hypertension and increased number of pulses. In the lower extremity you get exactly the reverse. And since there is a fibrotic ductus arteriosus, there is no question of shunting of the blood from the pulmonary artery into the aorta. So cyanosis would not occur here.